I can explain
what's
this,
going on here.
and then
Yeah.
we'll do the full exam. But this is just to look at your bite. So what we want to be seeing is you want to be seeing red on the last two molars. So you have someone over here, but none over here. And surprisingly, you favor your left a lot. And that's normal. Some people favor one side or the other, but it shouldn't be so much. We want to see red here. And guess what? This is where you had to get the root canal.
Interesting.
And I would bet any type of money that it wasn't just from a cavity that you needed a root canal. It was probably from favoring the side, clenching and grinding very hard.
Interesting. Okay.
Because we've seen there's actually cases or instances and people actually they just crack their tooth or they clench so hard that the nerve.
And the one that broke here is on the left too.
Yeah. And
actually, that's the one that broke, right? This one. Right?
We're gonna get to the top.
Yeah. Okay.
See, same thing. You have some red there. Should never have red on these front teeth.
Okay. Interesting.
So because they're very weak, they're not meant for chewing, right? And like you said, you have a little bit of red there. You notice the other one doesn't have any red.
Yeah, interesting.
And then the other thing too is you want to be seeing kind of again left side, preferring it heavily.
Yeah.
You're still pretty young, right? But as you get older, this is going to be a little bit less forgiving.
Yeah,
and it kind of
that's a good
matches
point.
up with your X-rays too, because we do see a lot of the problems actually kind of on the left side.
Okay, gotcha. What you're showing me now with the heat map, that was an X-ray. What was that?
Yeah, so this is just a 3D scan. We just got this available like last
That's
year.
fantastic. I think I have colleagues who do research on that.
Yeah,
Okay.
it uses AI too, so that's how it gets all of this. It's very,
so
very
it scans
nice.
it visually, and then what does it do?
It takes 100 photos per second.
Yeah.
So in the mouth when it was, and then it matches up your bite, and then based on the anatomy of the teeth and everything, it tells you like where things are kind of where you're preferring. So,
but how does it? What does the red mean? It means that.
So red means that.
What's a cue?
Okay, so
I know what it means, but what's the cue for it? Like, is it like damage? Is it wear and tear?
Yeah, exactly. Damage and wear and tear.
Oh, so someone built this program to identify wear and tear.
Exactly.
I got you. Okay.
Exactly, and just to help with the physics. So
David, that's the kind of thing you would work on.
So to me, I feel like we look at gums, right? We talk about cavities. Dentists who are a little bit better, they start to talk about gums because gums support the teeth. I think the complete dentist or the complete exam, then you address the physics. Because they're all related, right?
Yes.
You get more recession, and I'm going to show you something else on the map here.
Recession
the recession is when the gum starts to recede.
Oh,
interesting. And if you see, a lot of the recession is on this tooth, on this one.
Oh my gosh.
You see how there's no red here and it's higher?
Yeah.
So the mouth guard will help slow that down.
Gotcha.
Something to consider, okay? You don't have to do it now, but it's just something that the mouth guard is like a band-aid. It slows it down, it protects, but at the end of the day, you're not using the mouth guard all day.
Exactly.
Something to consider is maybe aligning the teeth so these forces are distributed a bit more equally. My biggest concern is with this guy, especially this back one. If you notice,
back left,
here it's a little bit, but it's not as bad.
Yeah.
Because what will happen is on these teeth, when they get a lot of recession, this will start to go lower, lower.
The gum will go back more.
Exactly, and then first you start to get sensitivity, like the hot and cold, because the bottom part of the tooth isn't supposed to be being exposed.
I got you.
And then what will happen is, in worst case scenarios, usually this tends to happen in patients when they get to their mid-50s, early 60s, the tooth gets loose.
Damn,
and then you need a super expensive pain in the butt gum surgery. Okay,
that's a very good point.
My goal as a dentist is very simple. I'm all about prevention. Okay,
that's great.
At U of T, I teach preventative dentistry.
Oh, you do?
Yeah,
great.
So,
okay, nice.
So if you're willing to listen, I'm willing to talk.
Of course, I enjoy it. Yeah.
So
I'm a UT professor too.
Oh, really?
Yeah, yeah. I'm in multiple departments. I'll give you a card for computer science, psychology. I'm getting medical appointments in the next year. For behavior change.
That's amazing.
Yeah, so it's getting people to change their behavior with technology.
Yeah. Are you at the St. George campus?
Yeah, exactly.
Small,
next to the bookstore.
Yeah, that's amazing. That's really cool. It's the campus is neat. I'm just over at 120. I usually go to 124 Edward. It's like
where's that?
It's kind of on Elm Street. It's close to Sick Kids.
Interesting. Oh, to Sick Kids.
Okay, because we do a lot of rotations in the hospitals. That's one of the nice things about U of T. No other dental program does that.
Oh, interesting.
So I think it's really valuable. But anyways, so essentially the red is very high wear and tear. Orange is second highest, and obviously as you get to blue is like the least.
Okay, gotcha.
So it's kind of surprising that you have actually blue and green. I mean, it's very rare to see this on none of the molars on one side. So it's just something for you to just.
So are there behavioral things I can do? Like, should I try shooting in the right side of my mouth, or like?
Yeah, you
are
can.
There certain things I should Google, like ChatGPT.
I think it's a physiology thing, to be honest. I think the best thing you can do if you want to try to get this side, obviously you can be conscious of it as well. But I would consider maybe I don't know if anyone's ever offered you an Invisalign consult or if you've ever had an appointment.
I haven't. So.
They can talk to you a lot about the physics.
And you think that's not just for aesthetics? It actually would help me not have to have a pain.
No.
I mean, that's worth it.
And I'll give you actually now that we can chat like colleagues, I'm going to talk to you a little bit. From an evolutionary developmental biology standpoint, the reason we actually view the straighter teeth as aesthetic is because back in the day, there was no dentists.
Yes.
When you had straighter teeth, the forces are divided more equally. Your teeth are going to last longer, so you have a partner. And so we view it as attractive, but really, from like, if you go back, it just means somebody's going to have their teeth for longer.
Interesting.
And so you want that in a partner, and that's why we view it as aesthetics. So for you, I actually think you have a very nice aesthetics and a very nice smile. Okay, so I'm not here to tell you about that.
It's okay. But my smile is trash. I don't mind.
No, it's not though. But I do think like we don't want to be seeing orange on these front teeth.
Yeah, I think that's a really good point because that's why those broke, right?
Yeah, exactly. And then the other thing I want to show you is like
this is the upper teeth, right?
This is the back.
Is this the upper? Bottom? This is the lower teeth, the bottom. Yeah.
But you're starting to also get a little bit of recession here. You can see how it's like pointed. It's not a nice circle, and like you see that.
Wait, show me that.
Yeah, here. Yeah.
Right there. So it's pointed where there's a bit more circular.
And look,
I got you.
No orange. You see what I'm saying?
Yes. So wow, because it's digging them into the gums.
Exactly.
The gums are kind of
exactly.
Getting
so this is more forward than it should be. It should be more like straight.
Yeah.
And when it's more back, it kind of goes like this and goes back. And then you get that recession back here. If your teeth were the opposite, which they're not, you would get the recession in the front. So if the bottom was more forward like this and they hit like this, they would go forward, they would recede here. Okay?
I got you. But so sorry, where, say that one more time, where are they hitting?
Right now, these guys are hitting, this is your bottom tooth, this is the top. It's hitting in the front, so it goes backwards.
Oh, I got it. That's like a recession in the behind.
In the back, exactly, because the force is coming here, and it pushes it to move back. Versus if you...
So Invisalign is probably expensive, right?
Yes.
But you do think not... And you do think it's worth it though?
I think it's worth it.
Because when you're 50, 60, you know, you don't want to be dealing with that.
Yeah, exactly. And I think if
eating
you can do braces too, I think braces is not worth it. Yeah, exactly. That too.
Braces would be a good job of me feeling comfortable with walking as an adult with braces. That would be a good, you know.
That's exactly why I'm saying braces. I don't. And for you, I think it's a quick. Like we can talk about it more after. Just something I
like how much? Like $5,000, $1,000. Will my insurance cover it?
I'm not sure. We can figure that out with the team. One of the really nice things about working here that I enjoy is I get to just focus on the dentistry. Like for the business side of stuff, I don't. I like the clinical stuff. So they'll help you out if you have any questions. Again, you don't have to do anything. I'm just bringing it to your attention because what I don't want is you to be like one of my patients who are 10 years down the road, 15 down the road, paying $10,000 for like I'm like usually the Invisalign is like cheaper than that.
I think what you said about preventive care is exactly right. The medical system is unfortunately pretty biased towards solving. We all are. Exactly. So preventive care is the way to go. So if you think it's actually worth it, like would you get it?
Absolutely.
Look.
I already have it.
Oh, you have Invisalign.
I had it already.
Okay, gotcha. Okay,
I got it all done, and then I still have the retainers, and I think it's really important because I've noticed my fillings last a lot longer.
Yeah.
Because what happens is
because you're just saving money, saving time, saving energy in the long run.
Exactly.
Right?
You're putting the teeth in the most favorable position mechanically.
Yeah.
Right?
Gotcha.
So, like I said, nothing lasts forever that will do, but your fillings will last longer if they're not being overly hit on certain angles.
If they get like hit every single day. They're essentially taking a beating with a baseball bat every day.
Exactly, and the reality is the enamel thins, okay? I don't know, we've never...
Funny look at that.
We've never figured this out yet, but if we're able to kind of rebuild the enamel, you don't have these problems. That's why if you notice, you've gotten more cavities and problems as you get older. When you're young, you don't have as many of these problems, right? So I'm going to show you just on the top very quickly, same kind of thing here. Right, and you can see again, here's where the red is, where the tooth chipped, no surprise, and there's orange. What we ideally would like to see is how your right side looks. Green is...
So you think, it's not just you want red, you actually want, because red means wear and tear, so you want everything to be green.
Yeah, or at least in the front, I want it to be, we're not going to be able to get it perfect because like, the reality is your jaw is a certain shape, but we can get it as favorable as possible, try to reduce the amount of, we don't want to be seeing this much orange, right, in the front teeth. You want to be seeing it more like this. And ideally, if we can get a little bit of red or orange here, right, we want you to use your right side more.
Gotcha, that makes sense.
We'll talk about it some more after. And you can actually kind of see, even on this tooth here, on the back left, if you have a cap, you can actually see the cavity. I saw it on the X-ray.
Really?
Yeah, you see the black stain?
Oh, that's ironic here.
Yeah, and then look over here. You notice so you don't have that?
Interesting.
And again,
because it kind of breaks it down, and then the cavities with bacteria get in or something.
Yeah, what happens is it just debonds. You get a little opening, and then you start to get...
Debonds, the enamel debonds from itself?
The filling debonds. So you had an old filling here, for example, and it starts to debond at the periphery. So your filling probably goes like this. And I suspect it's from the wear and tear.
Interesting.
Because you have a filling here, and you can see it. It's nice and clean. You see how...
I didn't know the filling there.
Yeah, so the filling, you see the difference in color here?
Yeah.
And you see here? So this is tooth.
Oh, that's that white thing.
Yeah, this is filling.
I got you. Whereas on the other side, it's...
You had as well here. You did have, but it's just... It has recurrent decay here and here. It's just some debonding.
I got you. That makes sense.
Is, and I'm cheating a bit. I could see it on the X-ray. Okay,
but no,
but it's helpful to know. So I'll do the full exam. I just wanted to show you all this, bring it to your attention. I would consider the consult Okay, if for whatever reason Invisalign is not an option for you this year for finances or whatever reason, I don't know. At least you can get the night guard and slow it down, but at least you're conscious of it.
Yeah, I have a night guard, I just haven't been wearing it.
Okay.
Yeah.
So, well, probably we're probably gonna have to get you a new one, to be honest, after we do some of the work, because that's another thing.
Fit.
Yes.
Oh, so it has to fit really well.
Yes, because
I should have bought my night guard here so you could see it, I guess.
Yeah, okay, it's okay. It's all good. You didn't know, but we can evaluate it next time. But one of the things I always ask my patients to do is to not use a night guard if it fits, if it doesn't fit well.
That's
because we've had patients that are unfortunately they don't like to listen. Okay, so
yes.
I've had patients where they got a crown, they spent a lot of money on a crown, they didn't want a new night guard because they got one kind of recently, and I'm like, you need one. If you're not going to get it, don't use it. They didn't listen to me. They used it. They came back. They actually broke one of their other teeth.
Oh,
when the forces change significantly, your night guard can do damage.
Oh, wow.
Yeah, because imagine if you do a crown or a big filling, and then normally it's touching there. Now it's not. The rest of their teeth are getting a higher force. The force of your bite doesn't
it's not even the tooth that's in question. It could be another tooth.
Exactly.
The dynamic shift.
Yes, because everything is related.
I guess it's kind of like glaciers or rocks when they move against each other.
Exactly.
Interesting.
So everything is related. So I just wanted to kind of like explain that, just because I feel like sometimes that's not explained. People don't know.
That's very helpful.
Yeah, no problem at all. Like I said, I'm willing to talk if you're willing to listen.
No, it's great. It's very helpful. I was just Googling you. So you have a website? Or?
No, I don't have a website.
But you're probably in this directory.
No, so I'm not actually an associate professor. I just guest lecture.
Oh,
so
nice.
I'm not on there.
Cool.
So I'm technically considered an instructor.
Gotcha.
But I do teach preventive dentistry. Usually
That's
with Dr.
great.
Ununu. You can see him on there. He's really good. But
that's cool. No, I just always like to learn about people. Ununu, how do you spell that?
O-U-N-O-O. Sorry. Sorry.
I mean, I just recorded a lecture here for you, and you can post this online on YouTube, I taught a U of T professor about dentistry.
I guess I shouldn't say the word professor, I'm an instructor, but yeah.
No, I mean, medical school is unusual. I think at Harvard it's a similar system. Your first level is instructor, then this, but I mean, professors are very loose term with many meanings.
Yeah.
If you teach,
that's how I use
the word professor of anything.
Yeah, I appreciate that. I did used to teach. So Dr. Aviv Ununu, so this is him. Okay, you can see him on the website. He's one of the really good teachers at U of T.
Cool.
But yeah, so I'm more of like an instructor, you could say. I did actually used to do anesthesia when I was in the program. I would teach other dentists how to do oral sedation, nitrous sedation. Yeah. But I don't do that anymore.
I'm most interested in preventive dentistry, because I think that's actually what 8 billion people care about. 8 billion people have teeth, right?
Yeah, exactly.
And 8 billion people could prevent damage to them.
I'll give you a bunch of tips and tricks after
that would be great.
I'll finish the rest of the exam.
Sure.
Okay? Quick question. Do you smoke or vape at all?
I don't know.
Okay, good.
What do you all take away from this? What is interesting? What do you tell someone else who learned is interesting?
Yeah.
That's one thing you could do differently after.